Hi, everybody, and welcome to episode 82 of the Pet Behavior Chat. So, we're going to continue on the theme of behavior medications, aka psychotropic or psychopharmaceutical medications. And today I want to address the question of how young is too young to start behavior medications, or is there even such a thing? So I think there's quite a lot of concern around starting pets on behavior medications at a young age. And when I say young age, I'm talking around maybe somewhere between 6 and 12 months of age. I think caregivers can be really reluctant to start younger dogs on behavior medications, even if they have a diagnosis. And I think even vets can be quite concerned about, is this too young? Should we see if they grow out of it? And I think there's quite a reluctance to actually be proactive and start behavior medications at a young age. And the reason that this topic has come up for me is because a really great team, a veterinary behavior and trainer team out of Grand Rapids in the US have recently come out with an abstract. So I don't think it's a published paper as yet, but it's certainly an abstract. And their work was presented last year at the Veterinary Behavior Symposium. And they actually looked at outcomes and side effects of behavior medications in young dogs, which is amazing because we absolutely need more evidence and more data around this. And we want to try and understand whether there are risks of starting dogs on behavior meds at an early age, and also, of course, whether they're effective and whether there's actually a positive impact of starting behavior meds at a young age. So when I saw this this piece of work, actually it popped up in my Facebook stream just recently, I thought, yeah, this is a topic we need to talk about because it's something that I think we come up against quite a lot as veterinary behaviorists, is the reluctance to start young dogs that are obviously showing signs of whether it's fear, anxiety, stress, early signs of separation distress, panic, conflict, all these things that we think about, all these sort of diagnoses that we can arrive at. And there's quite a reluctance to start these dogs at a young age on behavior medications. So I want to just chat you through my sort of top, 5 or 6 points that I think about when I think about this topic. And I want to just also present to you the research that Jill Sackman and her team looked at that was presented, like I say, at last year's Veterinary Behavior Symposium in the US. And what they found when they looked at these, I think it was 60 young and juvenile and adolescent dogs that they looked at, that they started on behavior medications, and they looked at the outcomes and side effects. So I just want to present that to you at the end. All right, let's get started with my point number 1. And that is, if we have a true behavioral diagnosis, and we've all seen those puppies that are just different, even from a very, very early age. They might be those puppies that are very different during puppy classes. They're the ones that really struggle to interact, that are very overwhelmed maybe with the environment. They show obvious signs of fear, anxiety, stress, distress, panic, conflict. And yeah, we've all seen those puppies, and we may well diagnose them with a behavioral diagnosis at quite an early age. And this oftentimes has either genetic or epigenetic or early life experience, maybe trauma or early life experience, fear learning as sort of an underlying basis or an underlying factor. And if we diagnose these puppies at an early age with any of these things, it is extremely unlikely that they're going to grow out of it. And I've heard these words so many times, whether that be out of a caregiver's mouth, or maybe even, a veterinarian who maybe isn't that familiar with behavior medicine, or who doesn't understand the genetic and the epigenetic and the early life learning components. They'll grow out of it. They'll get more confident as they get older. And in my experience, and I think in many other veterinary behaviorists' experience, that just simply isn't the case. It's actually far more likely that things are going to get worse over time than that these young dogs are going to simply grow out of it. So I think that's a really important point to note. And in fact, if we look at development of behavior over time, we know that behavior likely is going to get worse during that adolescence period. So, yeah, rather than them actually growing out of it in inverted commas, it's actually much more likely that things are going to get worse. And I do have an episode on adolescence, which I'll put in the show notes if you want to understand the challenges during adolescence and why behavior potentially gets worse during adolescence. Then maybe have a listen to that episode as well. But certainly behavior is much more likely to get worse during adolescence, during that sort of development period, as physical challenges occur, such as hormones coming online, and physical changes happen, but also changes in the brain during adolescence that actually reduce resilience, that increase the challenges of emotional regulation. And we very often see, so the typical age that I see a dog presented to me would be somewhere between 12 and 18 months. That's the typical age, because again, maybe they have shown signs in sort of earlier life from puppyhood. And when I question the caregivers, then often they'll say, yeah, they were like that from, as soon as we got them, really, they were different. They were anxious. They showed these signs of anxiety. And then things got worse. Maybe they were hoping that their puppies would change, grow out of it in inverted commas. And then actually during adolescence, when they hit that 12 to 18 month of age mark, things get worse to the point where they become unmanageable. Maybe the dog has grown physically and the behaviors are now much more challenging, also from a risk factor point of view. What maybe started as maybe nips now has turned into more substantial aggressive behaviors or defensive behaviors. And then, usually sort of 12 to 18 months is when then they are presented to a veterinary behaviorist for the first time, because we now have risk of, that human-animal bond breaking down. So that would be my point number 2, would be behavior gets worse during adolescence. And again, that comes back to that whole, it's really unlikely that they're going to grow out of it. It's really unlikely that things are going to get better. Actually, they're probably more likely to get worse. And then point number 3 moves on to that human-animal bond breaking down, a much higher risk of relinquishment, abandonment, rehoming, maybe even euthanasia, because it starts to become quite difficult to live with these pets in that time. Their behaviors, as I say, they get, bigger, more adult-like. There is maybe more risk of injury, more risk of bites, more risk of aggressive behaviors. So everything just amplifies those behaviors where we saw inklings when they were puppies just get worse, and everything amplifies. And then, of course, we have that risk of relationship breakdown, relinquishment, and euthanasia. So that would be my point number 3. If we do go in earlier with behavior medications, we potentially can reduce that risk of that relationship breaking down and the pets being relinquished, abandoned, or euthanized. Now, point number 4 is, if we have true behavioral diagnoses, even at a young age, it's very likely that we have neurotransmitter imbalances in the brain. And, you can learn much, much more about this in my psychoactive course, for example, or if you listen to other episodes of this podcast. We oftentimes I've heard colleagues refer to it as neurotransmitter disease, but it's essentially an imbalance of neurotransmitters. So some neurotransmitters might be too high, maybe glutamate's too high, maybe noradrenaline's too high. Other neurotransmitters might be too low, maybe serotonin or GABA are too low. And that then contributes to these behavioral signs. And again, that can have genetic components, epigenetic components that cause these neurotransmitter imbalances. So if we can re-regulate those neurotransmitter imbalances early on, then that again is going to have hopefully a positive impact for that pet's mental and emotional health and for their behavioral health. And the amazing thing to note about many of the behavior medications, certainly the long-acting behavior medications that we use, such as the SSRIs and the TCAs, so that's our selective serotonin reuptake inhibitors and our tricyclic antidepressants, is that, yes, they do affect neurotransmitter levels in the first instance. So in the first weeks and months of giving them, yes, they're going to, cause there to be more of a certain neurotransmitter type, or maybe less of a certain neurotransmitter type, to be available in the brain. But what's really amazing about these medications is that over time, we actually have a genome to genome communication between neurons, and we actually have new proteins being developed, if you like, and new receptor types being built in the brain. And so over the long term of giving these medications, we are actually going to change the way certain brain areas communicate with each other and the way certain neurons are able to communicate with each other, because we maybe have more receptors available, we have different protein types available. So it just over time re-regulates the way that certain brain areas communicate with each other. And that can be massively beneficial for these young dogs where there is perhaps a communication, certain pathways, or the communication within certain, neuron pathways or neuronal pathways in the brain is just affected. So we're actually making long-lasting positive changes to these young dogs' brain neurobiochemistry and the way that the brain is actually able to communicate in a healthy way. So that's a big piece for me. That's a massive piece for me, because we're not just giving meds to change behavior. We're actually giving medications to essentially change the course of this pet's behavioral health. We're actually setting them up for success. We're setting them up to be able to cope with our modern world and the domestic sort of challenges, I guess, that they might be presented with, of living in our world, and maybe, being able to influence some of those genetic and epigenetic effects that they have come into the world with. So that's a massive piece, and that's a massive reason we're actually addressing behavioral health on a much, much bigger platform here, in a much bigger way, and we're actually setting the path to success rather than failure for these dogs in their lives. The other big thing is, and this does come back more to behaviors, we want to prevent these dogs from rehearsing unwanted behaviors. And so if we kind of leave things untreated, they're going to be rehearsing unwanted behaviors. The neural pathways for those behaviors, those unwanted behaviors, are going to become strengthened, and there's going to be an element of learning that takes place over time. And as we know, fear learning is really quite strong and quite difficult to undo, if you like. So the sooner we can prevent this rehearsal of learning of unwanted behaviors and redirect the dogs into learning that we do want to happen, learning of more appropriate behaviors, learning of more coping strategies, again, the better that's going to set them up for success going forwards. And that is, again, something that we're trying to influence with behavior medications early on. We want to sort of influence unwanted behaviors. We want to stop them performing and rehearsing unwanted behaviors. And we want to open the window in the brain to create opportunities to actually learn wanted behaviors, more appropriate behaviors, and to be able to come in with behavior modification and to have that behavior modification be successful early on. So again, that we can stop unwanted behavior rehearsal and open that pathway to learning wanted behaviors. And then the final point I want to chat about is that maybe it might be possible to wean these dogs off psychotropic medications maybe earlier. And again, that all comes down to many different factors, how much behavior modification can take place, what is the circumstance of that individual sort of pet caregiver relationship, what are the possibilities of creating an environment that the dog finds it more easier to cope in. And, are we therefore then going to be in a better position to allow this dog to come off psychotropic medication maybe earlier? Whereas if we don't get to them until a later age, we're maybe going to be thinking about a much more long-term treatment with behavior medications. Now, don't get me wrong, it's absolutely possible that a young dog that started on behavior medications at an early age does remain on them for a longer term, maybe even lifelong, who knows. But I think if we come in early, we're setting up that scenario for success, and that we're maybe, because we're able to come in with management, behavior modification, changing brain neurobiochemistry, because we're able to come in with all of those amazing things earlier, we're maybe then able to get those dogs off those behavior medications earlier than if we were coming in at a later age. So I've talked a lot about dogs, and what about cats and other species? Well, the reason I've talked more about dogs is because we have this amazing piece of work that's come out from Dr. Jill Sackman and colleagues just last year. So we have an evidence base there, and I guess it's been looked at, and I'll go through the outcomes of their study in a second. We don't yet have that information for other species. However, mammalian brains all work the same. So if we do diagnose a true neurotransmitter imbalance or a true behavioral disorder in other species, then I would say the same sort of thoughts would apply. We just don't have the evidence there, so it's maybe not as easy for me to talk about that. But I would be as confident in starting a young cat on behavior medications if I thought that was indicated as I would a young dog. So let's have a look at this study that was done, this little piece of, or actually quite substantial piece of research that was done, and go through some of the findings that they had. So as mentioned, they looked at data of over 60 juvenile and adolescent dogs that had significant enough behavior problems that warranted medication. So again, it's that diagnosis piece that's really, really important. And so what did they find when they looked at that? So that was probably a retrospective study looking at those 60 young and juvenile dogs, or juvenile and adolescent dogs, sorry, they call them. And they evaluated the benefit and the side effects of using behavior medications. And the age of the dogs that they looked at was from dogs under 6 months and between 6 to 12 months of age compared to adult dogs. So the 60 dogs that were in their study were somewhere from under 6 months to between 6 and 12 months of age. So somewhere between that, that kind of age range from 6 to 12 months, and compared them with adult dogs. Then what they looked at were those young dogs when they saw them again at 6 months follow-up, so 6 months after initiating behavior medications. 86% of young dogs had improved behaviors, which is amazing. And that's a huge number, 86%. So that really is pretty significant. No side effects were reported in over 70% of the young dogs, and those that did report side effects were temporary and mild. So very, very similar and comparative to, adult dogs that are on behavior medications. And then finally, early treatment of behavior problems in young dogs with behavior medication is safe and prevents the continued development of more troublesome behavior problems. So that's kind of everything that I spoke about, right? That the development actually progresses over time. So things get worse, not better over time. And we want to get in early to re-regulate that brain neurobiochemistry, to prevent rehearsal of unwanted behaviors, and therefore the development of more troublesome problem behaviors over time. So I absolutely love this study because, I guess for us, when we see a young dog where we think, crikey, this dog really could benefit from behavior medications, but maybe this dog is only 6 months of age, then the conversation around, hey, let's get started with behavior medications can become a little bit challenging because of that perception of, but gosh, they're so young and surely it's going to change as they get older. They're going to get more confident over time. But as we know, that's not usually the case. And having this evidence from this study really sort of gives us a little bit more to go on and to say, well, no, actually, we do have a study to show that it's very effective. Over 86% of dogs showed improvement at a 6-month follow-up. And, side effects were mild, transient, and, there were really no side effects in a large amount of these dogs. So I'm so pleased that we have this research to go on, that we have studies to kind of support that. And I just want to be really clear in advocating for the use of behavior medications, psychopharmaceutical medications, even in young dogs where we are diagnosing severe behaviors. And let's face it, we're seeing these behavioral challenges earlier and earlier. Maybe that's because, we just have dogs showing behavior problems younger and younger, or maybe we're just getting better at picking those behaviors up. Maybe trainers and behaviorists that are running puppy classes are getting much more savvy at identifying these different puppies at a much younger age and are actually confident to send them for referral to veterinary behaviorists. We as veterinary behaviorists have always advocated for the use of behavior medications in young dogs. My mentor, my residency mentor, one of them, Dr. Kirsty Sexel, has always said to me, no, we start them young on, if we think that they truly have a behavioral diagnosis, we get them started young because of all of the reasons that I've mentioned in sort of this episode. So yeah, absolutely. I would advocate for starting dogs young and for not being afraid, for not waiting and seeing, because if you wait and see, inadvertently, those dogs are going to develop more behavior problems. They're going to rehearse the already existing behavior problems, and it's going to become harder and harder to treat those dogs, especially as they enter into adolescence, where we know we're then faced with even more challenges from a brain development point of view. So that is what I have. Now, if you're interested in learning more about the use of psychotropic medications, I have an amazing course for you called Psychoactive, which is my absolute pride and joy. We have over 60 participants already in the Psychoactive course. The feedback has been phenomenal. If you want to learn more, then I'm going to give you the link in the show notes, and you can go onto the Psychoactive page. You can learn more about the modules. We also have live group Zoom Q&A calls as part of the course, so we can actually jump on calls, discuss more about behavior medications. So if you're interested in that course, it is a course that has been designed with vets and veterinary nurses in mind, but any pet care professional that's interested in learning more about behavior medications, this would be an amazing course for you. And I also have a great hour-long webinar which introduces the basics of veterinary psychopharmacology. So if you don't want to go for the full course, there's also an amazing webinar which is just over an hour long that can already get you started on your veterinary psychopharmacology journey. And I will pop that in the show notes as well. But yeah, when it comes to young dogs, and again, I'm specifically referring to dogs here, although I would probably be confident in applying that to most species, then yeah, we want to be getting them started on medication sooner rather than later if we have a diagnosis that we're confident of. So I hope that's got you thinking a little bit. I hope that makes sense. I hope you've enjoyed this episode, and I very, very much look forward to seeing you in episode 83. Bye for now.